Good morning, everyone. I am the NHS Sickle Cell and Thalassaemia Programme Manager, and today I'm here to discuss a new proposed protocol for giving results to parents. The way we give results is really important. We knew that if results were given in the wrong way, it can cause distress and anxiety. We wanted to make the protocol more accessible for GPs, health visitors, midwives, and if you want to change a programme, then listen to the users. So we thought we'll ask the societies, as we did back in 2017, to do parent stories, so parent stories too. Powerful stories that actually make a huge impact to change.
We were founded in 1979 and we celebrated our 40th anniversary in 2019, and we continue to try and enable people with the disorder live a better quality of life, both economically and socially.
They are experts at education and campaigning and working with service users, and they really do get valuable information back to the programme.
We're that interface between the screening program and the users. We live in those communities, we speak the language of those communities, and they trust us. So we did a series of focus groups and discussions and one-to-one interviews. And we had social scientists in the project advisory group, and they helped us make sure that we were asking the right questions. We recruited via our networks, and they shared their stories, how it was when they were told they had a child with sickle cell. Today was bringing all that together in a report that we launched.
The event was aimed at all health professionals that are involved in the sickle cell and thalassaemia screening programme. Specialist nurse counsellors, commissioners, screening coordinators, midwives, health visitors, GPs and academics interested in sickle cell and thalassaemia.
In thalassaemia, within the newborn screening program, there was a huge sort of inequality and injustice in how those results were given. So now these were some of the main themes we found for our parents. And 100% of the cases that we spoke to, they all had to chase the baby's result. And that's quite sad. I have thalassaemia major. I'd like to think that I really care about the patient perspective and our experience, but this really gave me a different understanding of what the parents go through and that life-changing event that they go through.
They have up to 28 days to give people their results for their newborn child, but results can go beyond 28 days for technical reasons.
And I did do a quick poll round colleagues from 3 trusts where I've worked in the last few years, and every single midwife said, "Oh, I always say no news is good news." It's a phrase used to give reassurance when there is nothing actually to say.
When a parent has been thinking, well, they would have told me my child had sickle cell, and then they get told after the 28 days, it's not a very good thing, and it's something the nurses have to think about.
So disclosing news to parents in a timely way paves the path with how they cope and how they manage their child's condition.
Letters, people don't like letters. They are factual, but they're very cold. They can take a long time to get to the service user, and this isn't an acceptable way to communicate a life-changing event for her baby.
You have to always be factual. You have to give them the result. But you can do that in a sensitive, empathetic way. And today I learned lots of tips from clinicians that were doing presentations.
It's really important to plan ahead. I will plan in the antenatal period if that telephone call was going to come and we were going to give you some newborn results. Who wants to know? Does the mother want to find out? Sometimes the father says, tell me, and I will tell the mother. But if the family's not known to you, that first phone call you make is quite a blind phone call. You don't know where the person is, who's at home, and what information they know about these sorts of things. So it's always important to check where they are, because I've gone to give some results and they're in a car driving because they'll answer the phone, or doing a school run. Then once I've given them the information in a telephone call, I'll then arrange a home visit.
The nurse said, would I be able to come and visit you at home? I said, is it bad news?
It can be quite challenging hearing parents' stories, but you have to listen if you really want to facilitate change and make the pathway better, make it safe, make it effective. You have to listen.
I think with parents, the first time they hear the word thalassaemia, it's when their child is diagnosed. And when these results are not given in the way they should, they Google things. If you Google thalassaemia, first thing that pops up is life expectancy. It tells you that your child would not live past 30. And that's where a lot of misinformation happens, and like you have more stigmas happening because of that misinformation.
Each time I deliver the screening results, it's different. Each family's got different circumstances, experiences, beliefs, understandings, needs and expectations, all of which influence how we give the screening results and how they're received.
We need to really understand where they are coming from, their culture, beliefs, faith, background, in order to provide them the care that they deserve.
We had some young people who spoke about preconception.
On social media, there has been a lot of talk with regards to finding out your sickle cell trait status. And that particular video got about 50,000 likes. And in the comments, people were talking about, how do I get tested? How do I make informed decisions? What options are available? So people are very, very interested in knowing their sickle cell trait status. They just don't know how to.
So from our research, we found that people were finding there was a lot of pushback with talking to your GP, or the GP just wasn't taking it as seriously as you hoped they would.
There were very good questions about preconception, and we do some preconception outreach, but more needs to be done and it needs to be resourced.
Events like this, they break down barriers, they educate people, they talk about stigma, they talk about religion, culture, and that kind of collaborative effect will help improve the service.
And through that report which we launched, they will hear the voices coming out of those pages of the people that receive the service.